Good morning, everyone. My name is Adrienne Kodire, and I am the advocate co-chair of ACCESS. Thank you. You didn't think you were going to escape without me talking to you, right? I wouldn't let the opportunity pass. I am so impressed by all of you. And I am so grateful for all of you. I have words, but I'm going to start here first, which is that this was a dream that a small group of us momcologists, we call ourselves, had several years ago. Patrick, I can't leave you out. You're not a momcologist, you're a dadcologist. That we had to bring our community together in support of these children and families. So this is one of my favorite times of year when we all come together and I get to see all of you and the passion and commitment that you're bringing to this movement. So thank you. I want to start there. The genesis of ACCESS was the belief that we as a pediatric cancer community needed to come together to share and leverage our work to find solutions to our most difficult structural, regulatory, and scientific problems, done in service to improving the outcomes and quality of life for pediatric patients and their families like me. To launch this work, we called upon all of you to come together to form themes that, using your expertise and experience, would determine the initial projects that would begin to tackle these issues. These are the projects that we proposed to our CHR Pediatric Cancer Consortium grant. And I can tell you that that wasn't easy. That was a very difficult process to come to agreement as to what we would tackle first with this opportunity that we generated for ourselves. Since then, as you've seen in the last few days, we have formed an organization with governance bodies, review processes, formal advisory committees, networks, and community to oversee the 50+ projects that are now in process or underway. We have taken those ideas that formed during the nationwide proposal process and moved them to action. I know it is still frustrating, but if you think about where we started, which was me and Patrick in a webinar, we've come a long way. These are the things that we've seen during the course of the general meeting so far: infrastructure projects, clinical trials projects, discovery research projects, regulatory projects, direct support for patients, families, and advocates. One of the things that I've really felt incredible about over the course of these days is seeing all of you across disciplines, work, research together in rooms, hearing about research that maybe would not have crossed your path otherwise. As clinicians, researchers, scientists, hearing about what survivorship, social sciences work is happening may not be something that you encounter every day. So to see that engagement in these rooms together is one of the successes of this general meeting. Thank you. We are working to reduce or resolve the obstacles and issues that patients experience as they move through the pediatric cancer journey, from bench science to survivorship. As we promised in our grant proposal, what we have done is create an organization, a vehicle that can call upon a national network, that's you, of experts and partner organizations to determine and contextualize the problems pediatric cancer patients are facing in their journeys, and then work together to generate new national solutions. We are at the core a solutions generating organization.
So I like what Elaine said. The passion is palpable. And as you can see, we came by it honestly, and thank you to everyone in the room for this. But there's still lots for us to do. And I think we feel that, and it's really interesting to hear where Accelerate is 10 years later, and lessons learned from that, and what we're trying to do in Canada. As Patrick reminded us at breakfast this morning, this is started as and continues to be a patient-centric organization. And the advocates who put so much work into launching CPCC and now ACCESS are really counting on all of us to persist with this, to sustain this, but also to really carve new ground for us as well. So what we're about to start, and we'll hand it over to Ross and our facilitators momentarily, is to mobilize all of you, this interwoven community that we're building, to think now about the really big picture for our small patients, and to help us with the development of a national strategy for pediatric cancer in Canada. So from this strategy will also come a vision for the ACCESS organization of the future and what the role of that organization should be in helping to drive the success of that strategy. So today, I hope you're ready. We're going to start the early work. So really our first consultation on identifying what the key elements should be of a national strategy for pediatric cancer. And also what the development of that strategy should look like. Who do we need to engage? Who's maybe not in the room, virtual or actual, that we need to bring into this as well. So that's where we're at. We really look forward to hearing your ideas, and the bigger the ideas, the better.